One of the things that we're seeing happening now in healthcare is the takeover of medicine by corporations, consolidation. That's what they refer to it as. And that means that people are coming together. Hospitals are joining each other, merging to make bigger hospitals. Doctors are going to work for these large entities or forming larger and larger groups. But bigger does not mean better. In fact, very much the opposite. As these entities get bigger and bigger, what we're seeing is the quality of care being delivered goes down. It all becomes about profit. It all becomes about revenues. The last thing in the world that matters is patients. It's absolutely incomprehensible what's going on now and the way that patients are cared for, or I should say not cared for. People think, well, I'm going to go to this big institution. It's a big institution, big famous institution. I'm going to get much, much better care there. There are some isolated areas where that may be true, but to a very large extent, it is not true, because there is a lack of attention to detail, there's a lack of personalized care, a very high level of disorganization, generalized incompetence. Just think about what it takes to make an appointment. I had to make an appointment to see my doctor, and she works in a famous institution in Manhattan. And the last time I called up her office, I waited 12 minutes just to get a human being, going through all the computer prompts. And then when I was finally granted the privilege of speaking to a human being to make my appointment, I was told that they would call me back to try to accommodate me. And it's been about 2 weeks and I still haven't heard back from them. You have to ask yourself, if you can't even get someone on the phone, if you can't get the doctor on the phone, if there are that many layers of bureaucracy and that many layers of profound inefficiency, what do you think your care is like in these places? Do you think the doctor is really focused on your care? Do you think they're wrapped around your care and really giving you the personalized attention that your case needs? And it really makes me wonder, in a field like mine, radiation, where everything's on the line. You're treating somebody for cancer. This requires the utmost attention, the utmost skill, the utmost experience. And you look at these corporate entities, these big, giant group practices and these huge hospital systems, they're just not set up to do that. And in fact, they don't do that anymore. These places might be okay to go to train at, but these are not places that you want to go to get treated at unless it's something very specific that only they can do there. And that's very, very rare that that's the case. So that's really what separates us from these places. You get the skill, you get full attention, full customization, an outstanding staff, all the experience, and I'm available 24 hours a day, 365 days a year. You call up my office, you get a human being. We will do the pre-authorization. We'll schedule your tests. We will transport you. We'll transport you to the center free of charge every day, if need be, if you need that. We're going to take care of these things. If we need another type of doctor to get involved with your care, we'll find that doctor. We'll communicate with that doctor. We'll make that appointment for you. You're going to get the ultimate in care.